Hello, everyone. I'm Dr. Seema Gupta, and today we will talk about the Free Health Stop Clinic. It's my pleasure to introduce Dr. Sahadev Passey, a board-certified pediatrician in the Worcester area for the last 35 years. He has received a lot of accolades and awards, but amongst many other things, he is also the founder of Free Health Stop Clinic and has been running it since 2005 in Shrewsbury. It's a charitable project of India Society of Worcester and the Indian Medical Association of New England, known as IMAN. Dr. Passey, welcome and thank you so much for being here. So we just
Thank you.
wanted to know a little bit about the clinic and of course about you. What motivated you to start this and what does it offer to the community?
Thank you. Thank you, Seema, for having me and giving me this opportunity to talk to you and let our audience know what our free staff is all about. As you know that I've been involved very much with the Indian Medical Association of New England, and I have been involved with the organization since its beginning, starting 78, 79. And Indian Medical Association, we used to do a lot of free clinics off and on uh, in churches or temples and India Day festivals to provide free screening program for our community. And when I became the president of Indian Medical Association of New England in 2003, and the same time, I was also very much involved with the India Society of Worcester. I had joined the society in 1986 and have served their president and been instrumental in getting India Society of Worcester to build the India Center in Shrewsbury. So when the India Center was being planned, and that was during the early 2000, and we had our construction started in 2004. And at that time, the Iman was also looking for providing the free healthcare clinics. And we were partnering with a church clinic in Waltham on the Moody Street. And we used to do a free clinic on Tuesday evenings. And we were partnering with a free clinic which was already in existence on the Moody Street in Lutheran Church. So in the 2005, I discussed with the Iman and India Society of Worcester, and our India Center was established in 2004 in month of June. So in 2005, with the partnership of Iman and India Society of Worcester, we were able to start our clinic in the India Center in Shrewsbury. And we started our free health staff. That was the first time, the first session we had was on October 12th, 2005. And the main goal was to provide care for our Indian community and community at large. We had not restricted ourselves to just to Indian community, and we still, I mean, after 15 years serving, we do get about maybe 10 to 15% of our patient population, those utilize our services, are the American, those who live here. And about 80 to 90% of all the patients we see are from India. And I would say about 70 to 80% of the total patients we serve are the Indian parents, those who are visiting
Yeah, I would
from
think so.
India.
They don't have
And
insurance. Yeah.
yeah, and most of the time they are coming here, staying for 5 to 6 months. Some of them require some medical care, some of them are requiring refills on their medications, and some of them are just having a follow-up done on their blood pressure and diabetes and things like that. So that is the most of the patient what we see. And we do see a lot of pediatrics patients too, but that influx is mostly during the summertime when the new immigrants come into central Massachusetts and they are looking for school physicals or looking for immunizations. So we, unfortunately, we are not able to provide the immunizations, but we are able to at least review their shot records and give them a certificate what shots they already have, and what they do need to have, and then refer them to appropriate facilities to get them done.
So great, thank you. So people who are stranded right now, mostly the Indian community, we get a lot of calls from parents who don't know where to go. We can definitely give them this resource.
Absolutely.
So it must be also very challenging at this time with COVID-19 to be at the front line. And I know
Uh,
Dr. Mantalewala, he passed
yeah,
away with COVID-19 complications. My
yes, he
condolences
did,
on that.
and he was our backbone. He had started working with me at the India Center, providing the care for all geriatric patients for us since 2005, and he definitely will be very
Yes, huge
badly
loss.
missed.
Yes.
It
So who
was
do
a
you
big
have
loss to us.
helping you?
We have other internists and other physicians, those who do volunteer. We have uh, almost have about 2 to 3 different physicians, those who volunteer every Wednesday. So we don't ask people to be there every Wednesday. And but we are fortunate enough that in central Massachusetts, we do have a physician, those who are willing to do at least one Wednesday a month. So, so far we have not really been in the dire straits that we do not have a physician volunteer.
Right.
With loss of Dr. Lal, that may become an issue going forward. But unfortunately, right now, because of the COVID, we are have to shut down because we could not provide a guaranteed safety for our physician and the volunteers, those who are coming at the clinic. And that's why the unanimous decision among the physician and providers to just shut it down for time being. And what has happened is that the UMass medical students, first year, second year medical students, they volunteer in our clinic. There are about 5 other clinics in the town, and there is a consortium of these clinics, and medical students coordinate their activities.
Awesome.
So it is a really a wonderful thing what medical students are doing. And what they have done is that they have taken over these clinics. There are 6 clinics in the town. And from 6 to 8, almost on Tuesday, Wednesday, and Thursdays, three days, they do telehealth. And people are able to log into it, and the medical students review them, talk to them, and then we have a UMass faculty, those who take care of the telehealth
Awesome.
patients.
So from what I understand, your physical office is temporarily closed, but there are telemedicine and people who are still looking for medical help can call into these lines.
Absolutely.
How do they know where to call?
If they log into our iswonline.org, and there is a link there on the free health stop section,
Awesome.
and they should be able to get that information. And
iswonline.org.
online.org, yeah.
Got it.
And because we have been in the town for last 15 years, some of them, the patients, those who have been coming to us in past, uh, do send us an email. Sometimes we get an email or free health stop at gmail.com, and we are able to answer their question. And if they're looking for some refill, one of our physician, Dr. Ashish Verma, had been kind enough to review and refill their prescriptions too.
That's awesome. So much of great stuff everybody is doing, especially, in the medical community these days. So thank you so much. Do you have any message for us in the community?
Only message I will have is that please be kind to each other, and if you can spare a time and willing to volunteer, we can always use a new fresh blood, because we have people, those who've been working with us plus 15 years.
Right.
And sometime during the summertime when we get a overload of patients, the people are getting tired, and we would like to give them a break. And if people are interested to volunteer at least 1 2 hour time slot in a month, we would
Great.
love to have them.
I'm sure this is a great information to pass along for people who are watching our program. Thank you again. And I do hope our viewers have found this information very helpful, and people who can pitch in will pitch. Thank you. Thank you again.
Thank you. Thank you, Seema, doing a great job. Keep up the good work. We
Thank you
appreciate
so
that.
much.
All right. You take care.
You
Bye
too.
now.
Bye.